Okay, I think we'll get started. Welcome. We're so glad to see you all in Krakow. You know, my name's Peter Haggert. I'm chair of CLL Advocates Network, and very much my pleasure to introduce and bring you all here for this important event. We have terrific speakers. We put a premium on advocate participation. We put a premium on advocate participation with clinicians and researchers. So we have sessions giving the full picture with different people from the, my favorite word, sorry, ecosystem. And that way we can help hear different voices. We also hear different voices because, you know, we have large advocacies and not so large advocacies, and we try to represent them both because they sometimes have different needs, they sometimes have different messages geographically. There are so many different ways when you get a group like this together, so many differences to talk about. It's been an unusually hectic couple of days, of course, preparing, monitoring world events, keeping an eye on last-minute visa requests, and flights, but we made it. We're thankful for your participation. We're here to examine the many challenges facing the advocacy community. As we know, while some challenges are the same across all blood cancers, there are some very unique issues for the CLL patient. I'm thrilled we have representation here from 6 continents, both in person and online. This diversity of participants also means the diversity of voices, the richness of experience, and great many approaches and solutions to advocate challenges. Look forward to this very special week. So to start, I want to ask if Barbara Leonardi from the Creta Foundation is here. Are you here with us, Barbara? Oh, okay. So that's okay. She hasn't arrived yet. Now, I was calling on Barbara because Barbara is from one of our newest members, CRITA, and we're very fortunate to have them. They've been very helpful in putting this conference together, answering our questions about Poland, about recommending some contractors that we would use, those kinds of things. So we were thrilled to have them here. And Barbara was going to bring greetings from Poland, but maybe she can do that a little later in the agenda. The Creta Foundation, by the way, it promotes access to modern treatments, educates patients and families, and organizes workshops and support meetings across Poland. The foundation has been helpful to us, as I mentioned, and we're glad they can join us. The theme of this year's conference, the theme of this year's event is understand, decide, and thrive. Those three words that pop up a lot in our various discussions. They're the same themes that we used for our recent World CLL Day campaign. And thank you to the many of you who participated in that World CLL Day campaign, September 1st. And it speaks to some of the critical challenges facing the CLL advocates serving patients in 2025. We believe as advocates, it's our mission to make sure the CLL patient understands the stages of their unique expression of the disease, the options for treatment, and are well equipped to speak to their healthcare professionals. Because as we all know, knowledge is power, and with the power comes confidence and anxiety relief for the patients we serve. The transfer of knowledge and patient support helps the patient become in a position to make a better decision when allowed a shared decision for their treatment. Or at the very least, have an understanding about their treatment and where they are on their path. Good understanding can lead to good decisions. And when we make the best decisions, when we're able to ask the right questions, and when patients don't let anxiety about the disease control their destiny, it means a patient can thrive. And as our dear friend Brian Kaufman says, and I hope it is you, Brian, who says this, that's the impression in my head, the patient doesn't have to live with the disease, they live despite the disease. And as advocates, when we see a patient take charge, we smile, and that's why we're all here. For the next few minutes, we want to talk about the Horizons Conference and CLLAN. We want to give you a look at ongoing CLLAN projects and missions, and data creation. We'll look into the future too, as we, with your help, play a significant role in shaping CLL research, patient information, and the training of advocates. First, we owe a great deal to all those who attended last year's Horizons event. It's because the advocate participation in our conference last year that helped shape this year's conference agenda. We were grateful for the fine reviews of last year's event, the post-event surveys. We certainly encourage you to participate in those online surveys again this year. They're tremendously important to us, and we know that you have your own patient surveys that you want response when you hold your own events. So please take advantage of that opportunity to tell us what you think. In the workshops last year, advocates told us they needed training and more information on more than 40 topics. 40 topics, that's a lot. There's a lot of learning out there to be had. So we applied the information from the surveys. We applied the information from the workshops to this conference agenda. It's our goal that you leave here with 3 to 5 or whatever good number of good ideas you can implement in your advocacy work. We heard you say you wanted, we heard you when you said sessions sometimes speak to larger organizations or smaller organizations, but weren't always beneficial to both. So we've tried hard this year to present both perspectives in each of the, or as many as we could, of the different sessions. You'll notice this year many of the sessions feature a top-level clinician or two, as well as advocates across geographies. At the end of the day, proper patient advocacy, we believe, is the responsibility of clinicians, advocates, patients, and pharma too. The key players of the CLL stratosphere all must work together for the best solutions to many, many advocacy challenges. We're very fortunate. We have a membership, and that's you folks, of course, who are deeply engaged in what we do. We do know you use our reports, you come to our CLLAN website, and you are there for the community when a call goes out for a survey or perhaps participants for a trial or study group or committee. And we thank you when we call that you respond. But we want to ensure you all know about the full look of CLLAN's resources available to you and the projects we're pursuing or shaping to provide even more support. Now, one thing we've done this year, and I encourage you to take a look, at the very back of the room, we have a booth. It's really a booth just like you'd see at a show, and it's all about CLLAN programs. Now, there's a schedule on that booth as well, which will tell you who's manning the booth, and they may have a specialty they can talk about while they're manning the booth, or you can ask any question you like. But you know, we know that people possibly know 2, maybe 3 of the CLLAN programs, but we want you to know the dozen or so programs and pieces of resource that are available to you. We want you to understand the full picture and optimize your membership with CLLAN. So I want to talk a little bit about some of the programs that we do pursue, and I think we want to start with one program that is a rather large program that we've tackled and taken on, which is really an extension of what we've done through the years. And I'm going to ask our Chair Emeritus, Nick York, who you all know, who has been around for quite a while. I think that makes you old, Nick. Nick.
I see my grandfather in the mirror these days.
Yes, you do. And Nick, as you know, he has 10 far too dedicated years for CLLAN's, since CLLAN's initiation, and he stepped down as chair last year because business was calling, of course. As we're all volunteers, it is hard. It's hard sometimes to do both. He's also remained a central leader in many of our core projects, and the CLLIC task force is one. You'll hear more about that at our joint session with IWCLL on Friday, but for today, Nick will introduce you and let you know how we got to the point of forming the task force in the first place. Nick?
No challenge. You hear me? Thanks for having me back up on stage. I'm trying to approach this from a direction of reflection and kind of the evolution of you as a network, us as a network, our activities, and that centers on us working together to that core work has been building the network over the last 10 years. So we were looking to identify alignments and key unmet needs, and then prioritizing the projects that we've determined and work together to address those. And the key part of that is involving varied and diverse experiences. And part of that isn't just, as Peter pointed out, just as us as a network and building that knowledge, collecting that evidence in our various surveys since 2018, 2019, but it's also the relationships we have with the broader community, as Peter pointed out, the clinical community, and working together. And I was reflecting, if we say CLLAN has been here for 10 years, we came together when there was a beginning in the revolutionary change in how CLL is being treated. We came together when predominantly the backbone of CLL treatment was chemoimmunotherapy, and unfortunately, it still is access-wise for some in this room, people we were talking to today. But with that in mind, those treatment advances potentially have made a shift away to certain aspects of need in patients' quality of life, well-being, improving outcomes, because those treatments really focused on the key message, wasn't just improving people's day-to-day life, which palliative care is meant to be about. It was more about survival, extending survival. Chemotherapy was the only route to extend survival, and almost at any cost, because it added layers of challenge for patients. So I was kind of reflecting on that, and our priority over the last 10 years is trying to keep pace with regular aspects of advocacy, and that might be addressing access issues, information, education, empowering patients, thinking what Peter just said there, to become more able to become involved in their healthcare discussions and their own. But one thing that was never addressed, and I think it still stems from those old days, because advances in CLL has been led by therapeutic research. Any research outside of that wasn't able to be funded and really didn't have the attention of the community that could help us bring about changes to improve patients' quality of life, because the treatments were what they are. At that point, that's what they were. And I think that revolution at the moment, from an advocate's point of view, has massively changed perspectives for those that have got access. We still have to do our work to educate, to press for equity of access. But then COVID came along. I mean, what can everybody remember that terrible situation when that first arrived? And as an advocate community, what did we do? And there are members here in the room, I think at that time, we'd done some work where everybody had contributed to a survey, in our advocacy survey, to share their perspectives on the impact of COVID on you as organisations and on those you serve as patients. But we needed to react because patients needed protecting. There needed to be some consensus amongst the community to make sure that information was able to get to patients and was possible. So we discussed that at the last horizon, that virtual horizons. We couldn't come together because we were in the middle of a pandemic. And it was determined that the problem is far too big for just CLL. We had multi-stakeholders in the room across the blood cancers. So it was something that first united us all, both the clinical community, the clinical research community, the institutions, the whole CLL community, but the whole blood cancer community came together. So that as a united front there, we worked to actually produce information to help people navigate the challenges, but also to press for the right access to treatments and solutions to help people if they test positive, if they contract. We didn't know a lot then. So it also opened another door in the clinical community, didn't it, to an appetite for research. The clinical community had to research gaps in knowledge to understand responses to vaccination in the CLL community, to look at that dysregulation. The real problem in CLL is that immune-related dysregulation that creates a massive opportunity for infections and the extreme side effects, autoimmune relations, second cancers. None of this is uniformly shared as information to patients. There's a low awareness in that, and there's a gap in the knowledge. So there is something that came out of COVID. As a combined community, we formed the International Blood Cancer Coalition, and that helped us sort of make some statements, set the bar of good practice to ensure that there was understanding of what would help our patient community to potentially deal with this and make sure that information got out. But it wasn't CLL specific. So we carried on as a network, adding questions into our surveys so we could help build a little bit of evidence on what the impact is on people's knowledge and information, if they understand their vaccination requirements, if they're informed. And we talked about that at the last conference. We shared some slides. I think AJ shared some information about that. And we moved forward with that. We're now, what's happening in that space, we are now working on a white paper, the writing up of that, a full white paper for publishing, to add to the broader evidence pool to help bring about some change. But what we have learned, all of the initiatives and the projects that we've initiated all involve working groups, and all of our working groups over the last 3 years have developed. They're not just advocates. Our working groups are made up of the clinical community, the research community, across different stakeholder groups in supportive care and haematology and immunology. And what we learned by bringing the community together, that maybe we could actually leverage some real change. And this initiative, the CLL Immune Compromised Task Force, has come about following all of this from some early work that we did. I don't want to over-talk about a lot of it because we're going to share the information properly at our shared session, which Stephen is here, who's just joined us. Nice to see you, Stephen, where we'll talk in detail. But we did a lot of preliminary work to collate the evidence, to define what the issues are in CLL, recommendations how to deal with this. And we've succeeded. We obviously have built a large reputation, and from a point of view that this initiative is worthwhile, that a very broad stakeholder group across institutions in haematology, in immunology, in supportive care, in psychology, individual professors and experts, the advocacy community, in specialist knowledge in CLL, have all come together for one reason, that we can focus on this great issue in CLL, the most negative impact, and I'm not talking without evidence. I think the clinical community uses the phrase, as the clinical community accepts that the immune challenges in CLL pose a real negative impact on the quality of life of patients, and there are serious morbidity issues. But actually, when you look at a patient's quality of life, if your immune system has been affected, or even if it hasn't, if you haven't got the information, it has one of the greatest impacts on your day-to-day life, your quality of life, both wellness, in terms of propensity to become unwell, avoidance, isolation, psychological challenges, so much that's never been addressed. So basically this program has brought together our whole own community, and it's still open. We have 2 working groups, which we'll talk tomorrow. You know, there is a track that is for the advocacy, and there is a track for the clinical group and the clinical research groups. And the idea being that many of the people on these events are actually the people that are defining the guidelines that are put down as standards of care within the CLL community, and that there are things that we can change together as a broad community. And by bringing those together that can make those changes, hopefully it will get the ball rolling with a self-sustaining, not an institution, but an initiative that will address a chronic problem with a chronic solution. So this isn't a short-term project. It has some initial objectives over the next 2 years, but there is hopefully that it will have impetus to bring about change and focus on what seems to be invisible. So many patients have no information about how immune compromised or challenged they might be. And so many clinicians seem to also ignore that and don't have that information. So we as a community, and that's something CLLAN has built. You know, as a group, we are very well integrated now with our clinical community. And I'll come to that word PPIE. I think what's that? Patient and public involvement and engagement in health research and social health. I think that's the definition for that. And that's what it is. That's key. And the key for good definition of that is partnership, working together to achieve those goals. So we've come to a new horizon, and I wanted to just mention that, finish my little chat. CLL horizons. Have you ever noticed when you get to the top of a hill, there's another horizon? And what you saw as a horizon then is now. So I just want to emphasize, a lot of the projects that we're building, we're still working on. You know, we're working on greater understanding of unmet needs in the active monitoring space and looking to address initiatives to focus on those unmet needs. People that are at different state, you know, different aspects of CLL with regards to coping with side effects, for example, and with the new treatment regimens. But there's also there's a treatment void in CLL at the moment in the relapsed refractory space. So as CLLAN, we've also got initiatives where we've been working with you as stakeholders, with focus groups, to look at how can we address the unmet needs and understand what the needs are in those spaces. So we're working on the present, we're working on the education, but now we also have a new horizon and we have a new opportunity. And I just want to reflect on it because I was reflecting. In my day job working for Leukemia Care, one of our moderators of our Facebook group last year, we lost her because she died due to a COVID infection. And if I think of people in the room, other rooms where we've had advocates, I've lost so many faces and peers because of the infectious complications of the disease. But if we actually look at those we serve, and I don't know if the data, maybe Professor Opat and others can talk tomorrow or might be able to find out, there was one definition I just wanted to leave for. The words greatest cause of morbidity and mortality in CLL are infection-related complications, potentially second to disease progression. That's how it was explained. But is disease progression now the greatest cause of death in CLL, or is it infection-related? So it just puts it up there, just how important this issue. And if we've got power as a network, and look at the mission and the vision we had, coming together to have the strength to address key issues together, that thing that was a horizon in previous meetings is a now, and we've now got a new horizon. And it's down to us all being able to work together to achieve co-creative solutions. So I don't know if that kind of explains what the next step is. Yeah? Is that what you wanted? Thank you, everybody. It's you.
Very well done, and many people were just aghast that Nick was going to talk for 7 to 10 minutes. But he did a very good job, and it is clearly complicated, but it just shows the depth, and it shows the direction and diversity of what we do, what needs to be done within the field. And I think my favorite words of what Nick says is that this is self-sustaining, and there will be projects. This isn't a 2-year mission. This goes on, and this goes on, growing the capabilities within this network. So thank you for that, Nick. Very good. And if you look at the names, if you see online, if you look at the names of the people on the working groups and the steering committee, there is a very impressive list of participants, many who are in this room today, and we're so grateful for everybody who's involved. It's just that important at the end of the day. So, very good. Of course, you'll hear more about that on Friday in our joint session with IWCLL. We're very keen and we're very happy to have that joint session just to spread the advocates' word there and to hear what they have to say as well. And anyone still who wants to attend the IWCLL sessions, we can probably make that happen still, because we do have a number of passes available and still available. So please just let Myrna or myself or anyone in the steering committee know, and we could probably make that happen. Now I want to talk about one of our most exciting accomplishments this year. And presently, our Global Clinical Trials Hub has been in a beta situation. You love these terms. But today, we'd just like to announce that this is it, that now we've taken that beta, we've decided, we've looked at feedback, and we're launching officially that Global Clinical Trials Hub today. Johannes, Forner, and a small team took a look at available resources, difficulties in user experience with these kinds of hubs, experience with existing databases, and set out to build our own. What I like about what Johannes and team did is they didn't try and tweak the existing, but they kind of said, okay, to make this as user-friendly as possible, we start from how would we build it? And that's inevitably the better way to do things. So I'm now going to let Johannes tell this story and give you a little demonstration.
It's so good to see so many familiar faces today. I always enjoy these conferences. Now, I need a little bit of technology today to show and tell you what the next couple of minutes are going to be about. After the so-called soft launch, which happened in spring, I actually thought my job would be done with the hub because it was working, it was reliable, and it was stable. But you guys out there and the people who beta tested the system told me, no, the job is not done yet. We need more of that. So before I go into the more of that, which is tomorrow's version or V2 of the Clinical Trials Hub, I'm going to tell you a little bit about the background of the hub and give you a short demo. Now, I hope it's going to work. No, it's not. Can I get the next slide, please? So, here's some background. Why did we do it? How did we do it? And how can you use it? Why did we do it was quite simple. I got diagnosed with CLL in 2020. And the first thing I did after the diagnosis sort of settled down and I was fully aware of what I had in my body, I surfed the internet and got in touch with a lot of clinical trial databases I was trying to make sense out of. There was clinicaltrialshub.gov in the US. the CTIS database, and a whole myriad of other smaller databases which were operatable in different shapes and forms. So you always needed a new PhD when you moved from the one to the other, and you needed a translator in order to understand what was on there. So I said, this can't be the future. And when I became a steering committee member of CLLAN, I said and convinced the team that we needed to do something about it. So why did we do it? In order to make search for clinical trials simple for patients on the planet, that they don't have to go to a myriad of more than 30 databases out there, but just have one place to access the trials. Now here comes the how. It's simpler said than done. Consolidating 30 databases into one is not an easy piece. So I went out there and talked to a lot of people who had experience with clinical trial databases. And guess what I found? I found the World Health Organization based in Switzerland and had a conversation with them about clinical trials. And they've already done this project before. They've designed what they call their International Clinical Trials Portal. And they've done most of the legwork already, consolidating more than 30 databases into one, but not only for CLL, but for all clinical trials on the planet. So I had a conversation with a project manager there and asked, how many trials have you got in there? He said, well, it's actually close to the tunes of 35,000 that are active on the planet. I said, that's far too many for us. We don't need all of them. We just need the ones for CLL and SLL. And we had a conversation then on how we can skin that down and get access to just the data that we need. So we designed logic that only gives us the clinical trials about CLL and SLL. We then set up our own database, and we're getting data feeds from the WHO on a weekly basis with all the updated CLL clinical trials. So what you find on the CLLAN website is a total of, I think at the moment, we're just below 3,000 clinical trials, global clinical trials, and we always have the updated version in there. Now, how can you use it? You can use it in a very simple fashion. You just go to the CLLAN website and select the clinical trials hub. And if my technology works now, I'm going to share a screen and give you a quick demo of the hub. So here we are. That's the CLLAN website. The hub lives up here in the CLL Advocates Network tool section. What you do is just click the Clinical Trials Hub entry and you're there. If you scroll up, you find a little bit of information about basically some background data about clinical trials, what they are, why should patients consider a clinical trial, eligibility and enrollment, how that works, potential risks, there's no fun, no risk, as we all know, the current research in CLL, so what is the latest and greatest in that area, how to get involved in research, how the search for the trials work, and the terms of service, obviously. And our goal was to develop the user interface as simple as possible, so that only with a little bit of entering text and a couple of boxes to click and pressing a button, you can find the trial that you're looking for. I'm going to try one now with a brand new medication that is not approved yet globally, but that looks very promising. It's a drug called sonrotoclax. So I enter sonrotoclax up here, and I want to know how many or what clinical trials are available on the planet with sonrotoclax. The system does its magic, and it gives me 13 results. So it says, I found 13 clinical trials worldwide that deal somehow with sonrotoclax. Now I want to know the trials that are recruiting, because there's many in there. There's just preparatory data in there informing people what's coming, but I actually want to know these ones that are open for recruitment. I tick that box, I hit search again, and it comes up with 6 trials. Now I want to hone down again into more detail, and I want to know which of these trials are open for recruitment in the country Denmark. I could take any other, but in this case, I'm going to take Denmark. Hit search again, and it comes up with 2. I'm going to look at the first one. It's a prospective, open-label, multi-center phase 2 trial to available a whole raft of drug combinations. In one of the arms, sonrotoclax is included. It's open for recruitment. The sponsor is the German CLL study group, the University Hospital of Cologne in this case. And the trial is open for recruitment in Austria, Germany, and Denmark. So that's the hit. I have inclusion criteria, which I can display. I can hide them again. I can also have a look at the exclusion criteria. I can hide them again. And I can go to the full trial, because we're not displaying all the information there. It just would be too much and too confusing. If I click Go to Full Trial, it takes me to the website where the clinical trial lives, which is the CITES database of the European Union. So in that database, I can have a look at all the data that is available for that specific clinical trial, including where it's recruiting, when it started recruiting, what is the study protocol, and things like that, and more and more and more. If I go back and I do another search, and I'm going to stop after that, and look, for example, what's available for venetoclax, then we're looking at 370 trials worldwide. I can distill down again to the ones that are recruiting. And I'm ending up with 115. So you can do this for any medication, for any condition, whether people are treatment naive or in relapsed. You can select the phases you want to look the trials for. You can even do an advanced search where you can exclude certain search fields if you want to go more precise down to the results game and get more precise results. So I'm going to stop the demo now and go on with my slides. Let me see if that clicker works now. No, it doesn't, for whatever reason. Can I have the next slide, please? So here you see the clinical trial information of today, what is in our database. Just for one that I used, it's for the CITES 2024-51 trial. Next slide, please. And our feedback that we gathered from the users in the beta phase, where we asked the questions, is the information accurate and relevant? We got a yes, because it is. There's all information there that is available about the trial. Does it look nice? Well, there's different opinions about this one. I personally don't think it looks nice because there's only text. Is it easy to read? Well, definitely not. And it's not easy to read. It is very complex. Next slide, please. So what are the plans to go about these issues? What we sort of thought about is converting a complex language that is used today in these trials into an understandable language. Not display all information any longer, but information that is patient-centric, that is really relevant for the non-medical patient that doesn't have a PhD in science and in medicine and just wants to understand what he or she can understand. And instead of multiple pages needed, we want a quick information on one page, easy to digest. So how do we get there? Next slide, please. The magic seems to be artificial intelligence. And before I'm going to show you the next slide, I have to tell you a story. I've been playing with AI for quite a while. In the beginning, the first 6 months, I wasn't very successful. There was a whole lot of nonsense coming out of these systems until I learned how to operate it. I'm also really happy that I have a son. He's got a Master of Science in informatics and is just about to do his PhD in medical imaging using artificial intelligence. I had a conversation with him and he gave me a first couple of results, which I was able to look at within a couple of hours, which I would never, ever have been able to do. Next slide, please. So this is what AI applied to the previous slide that you saw came up with. There's a trial ID that we need in order to have some further reference. The title hasn't changed, the condition hasn't changed, phase hasn't changed, countries hasn't changed, but the summary has changed dramatically. So AI gave me basically a distill of the information about what this study is all about in ordinary, simple to understand language, as you can see here. The research project called IMPROVE, that's the name of the trial, is looking at a new way to treat people whose chronic lymphocytic leukemia, and I don't want to read all of it. You can read it up yourself or see me afterwards at the booth where we can go into more detail. Why does the trial matter is the next very, very important piece. So why should patients consider this trial as part of their treatment? Who can join? So it's basically a very simple summary of the inclusion criteria and exclusion criteria that you saw before that alone were 2 pages long. So not understandable and not digestible for any of our patients. And the last bit is probably the most important. This is the one that you only find on clinicaltrials.gov and on CITES. What are you going to do if you're interested? In this case, very simple. Contact the team at Ospedale San Raffaele, Professor Dr. Paolo Gia with the telephone number. And it also says the study is currently not recruiting, but you can stay informed about the go-live date. Next slide, please. So the information, is it still accurate and relevant? Absolutely, yes, it is. Does it look nice? Now I'm looking for answers from the audience. Does it look nicer than the one before? Is it easier to read than the one before? I think that's a big yes, and I believe once we have that system in place, it's going to be really, really great for all our patients because finally they have a clinical trials database with the majority, I wouldn't say all, we're probably close to 95% of all trials available on our database in a simple to read and to digest fashion. Next slide, please. So what are the next steps? We're still at the beginning of the evaluation phase. I've been playing around together with my son with a bunch of large language models. There's still some to be evaluated. Some are better than others. Some are more precise than others. Some give you more so-called nonsense than others. So we want to pick the one out that's most appropriate for the job that we want AI to do for us. We have to scope the project because this, again, it's easy to build a prototype, but it's not really easy to put it into a sustainable fashion. We need to scope the process. It costs resources, it costs time, and it costs budget. Then we will need to build a workable prototype on our database, which you guys can test and give us feedback again if it's valuable, if it contains more nonsense or less nonsense, or if it's just about right. And we need to validate it with the clinical community, because the text that people can read is not the original anymore. It's been modified by artificial intelligence, and we need to make sure that the content is still appropriate, is still correct, and still valid, and that's probably the lion's share of the work. With this, I'd like to extend a big thank you to all testers of the current system, and I'm very much looking forward to seeing the same or even more beta testers in the new version of the system. Thank you very much.
That's great, Johannes. As you can see, Johannes has put a lot of work, a lot of thought, he and his team. And again, all the testers, it's all important, and it's come together in a great way. We've put a premium this year on partnerships. It's our belief to strengthen numbers, strengthen connecting with others across the CLL spectrum. And you'll see that theme ran across the projects you've heard from so far. Now I want to bring one of our steering committee members, Jennifer Wilson, who's from Blood Cancer United, actually, in the U.S. And Jennifer will speak to us a little bit about some of the partnership initiatives.
Hello, everybody, and welcome. We are down. Thank you, Brian. Welcome, everybody. We were truly thrilled to have everybody here together as one community. One of the things that I had the opportunity to do, and that I'm going to continue to do, is reach out to stakeholders. We need to know, who are we reaching? What are the challenges within your country? Because as we come together as a group, everyone comes from a different place with different treatments, with different resources, different supports. So when we get together, this is our chance to share ideas, let everybody know about your organization. I truly hope that while you're here, you'll meet new people, you'll sit at a table with people you don't know to hear what's going on in their part of the world. And I think that, between Nick and Johannes, these are such important projects, and having everyone come together to participate would be terrific. Also, I would say we have projects like World CLL Day. It's raising awareness. It's finding out who are the people in your community who are supporting CLL patients. What do they need? What's missing? What do we need to know? And how can we support you? Or perhaps you'll hear about a project over the next few days that will inspire you and you'll choose to participate in. Ask. We're here. We want to include everybody. We want everyone to sort of feel that they have a home, regardless of what exists in your sphere at home, but you also have a place in the CLL community, and we're delighted to have you. And I think we're pretty much out of time, but I wanted to say hello, welcome, and I hope that if I haven't talked to some of you, that I will have the opportunity to do so in the next few days. So, thank you.
Brian? So what Jennifer hasn't mentioned really is this outreach has led to new members this year. It's led to new members, and it's led to new participants at this conference here. And we're very thrilled to see the new faces, a new exposure to CLLAN, and to welcome, I think it's 3 or 4 new members this year so far. So very good news. And that brings us back to the booth at the back. The booth at the back, which has a lot of information to it. And what you'll find, just as you'll find under the tab for initiatives on our website, you'll find there's information on so many of our projects coming up through the last year, through previous years, and through New Year's. Now, it's funny because earlier this year, Myrna, who many of you know, and I, and Michael Ryan worked as a communications committee, and we said we've got to find ways to highlight the new projects. So while in the back of our minds there's a new website coming, on the very front, we do have the ability, at the present, we have the ability to post new things on the front of the site, but also we post in the initiatives with the word new. And I looked at that yesterday and I thought, my goodness, all the new things listed. It's like the growth of the projects, the growth of what we've done goes like this, and it's growing exponentially. And you'll see on there things, if you haven't been in for 6 months, you'll see reports and a lot of things that you may not have seen before. I'm just going to quickly talk about some of the things that are there. For instance, you'll have data projects, publications, and such. So the CLL Immune Challenges white paper is there. And this is a, there's a patient information guide, a BTKI patient information guide developed with Johnson & Johnson. There's the CLL Active Monitoring CTA, which is another guide working with B1, empowering patients with CLL during active monitoring. It's a call to action. There are Global CLL Community Insights. And this is a publication working with AbbVie and Global CLL Community Insights, how stakeholders can collaborate to improve care. There's the 2024 CLL Advocacy Survey. You know, we did a brief and we had a what would you call it, sort of an initial look, which we sent out earlier this year. The full survey's results are now on the website itself. These are very instructional pieces for us, of course. We have the 2023 Global Survey Insights, which recognize the unmet needs with recommendations of actions. The Blood Cancer Patient Advocates Academy. Many of you took the last course that was offered this year on speaking to the newly diagnosed, and that was a tremendous course. I think we had 86 participants at the end of the day. That course, by the way, if you weren't able to take it, it's now posted as an on-demand course on the Blood Cancer Patient Advocates Academy website, and on our website too. You can get to it from there. We've built new alliances, partnerships with a number of organizations, and I want to pay particular attention to one organization today who's familiar with many of you and has played a critical role of bringing new medicines and hope to regions who otherwise would not have it. Recently, CLLAN signed a memorandum of understanding with the Max Foundation. It's a partnership we're very excited about, and it will provide us with insight into the challenges of new regions and allow us to help advocacy grow in these areas. And the bottom line, of course, as is for all, providing the best possible outcomes for patients. I would ask Max Foundation Program Officer Shalili Subramanian to come and say a few words about the partnership and about the Max Foundation. Oh, why did you sit at the back? This is actually the announcement of the signing of the MOU, so very happy to have you. That's very good. Thank you.
So, good afternoon, all, and I'm very happy to be a part of such a big patient advocate. So, I'm Shalini Subramaniam, and I'm from India, and I work as a program officer in the Max Foundation and handle the programs in Nepal and Sri Lanka. So, Max Foundation has accelerated health equity for last 25 years, and we do this by delivering medication, technology, and services to the patients living with cancer and other critical illness in lower and middle income countries. And our program supporting CLL was launched in 2023, and since then, we have been able to support 270 patients in 3 countries, providing them access to treatment through second-generation BKI inhibitors. And I proudly say that our organization is very collaborative, and we also believe that this partnership plays a key role in overcoming the access barriers faced by the patients. And here, today, I'm very much thrilled to announce a partnership with CLL Advocates Network, where we can increase the supportive care to the patients living with CLL worldwide. And as I said, our organization is committed to improve the outcome for the patients living with CLL in limited access for treatment and diagnosis. And we are very much excited to support the Advocate Network with education and advocacy resources. And I'm very, very happy to be part of this advocacy network. Thank you so much.
Thank you very much. We're very excited. We're very excited to be here today. So we have a full day ahead of us still. You have old friends here and the opportunity to meet new ones. I really have 2 challenges for you while you participate this week. 1, find somebody you don't know very well and get to know them very well. Build a new bond with somebody today, someone you can call on, someone you can bounce ideas off, someone who has a different perspective than your own, and grow that relationship. And the second challenge is to find 3, 4, 5, whatever number you like, ideas large and small that you can take from this conference and implement. It can be something to guide your own work-life balance as an advocate. It can be a tip on a resource use. It can be teaming, learning how to handle certain situations with staff and with patients. It's endless. The possibilities are endless here. And by the way, we always talk about that. Jennifer, who you just heard from, has a very unique job. And frankly, what Jennifer does day in and day out is speak on the phone with CLL patients, helping them out as talking it out, if you will, and helping them with certain situations where they need a little bit of guidance. So Jennifer is quite an experienced person that you all should get to know. So onward we go. So just a little bit of housekeeping before we move. First, if you're in the next session, and when your session comes up, if you're a speaker, please come to sit at this table here. It's going to make things easier. That would be great. And after breaks, okay, sorry, I'm just reading a little bit. Okay. There will be questions at most of the sessions and questions and answers, and there will be a microphone. Michael Ryan will have people doing microphones through the group. Please don't be shy with your questions. We're all here to ask questions and to learn from some of the real learned people in this place today. And again, I just want you to make sure after this session today to know that there is poster presentation. You see, we have our posters here, so you'll have a good look at them throughout your day. It's wonderful to write on spot here. We had a great diversity of posters, and I look forward to seeing them. I haven't seen them myself yet. And dinner will be at 19:30 in the hotel restaurant. Finally, 8 a.m. Friday morning is the first of the breakfast satellite symposiums. If you recall, last year we had 2 satellite symposiums, and they were very successful. One was with B1 and one was with AstraZeneca. They were very successful, so successful that they've come back for a second year to grow on the work that was accomplished after the sessions of last year. So tomorrow's satellite session is with B1. You can read about it in the agenda, please. And please, 8 a.m. We started at half an hour later this year, working to your feedback to give you a little bit more sleep. So please, we have 8 a.m. Friday, B1, and then 8 a.m. Saturday with AstraZeneca.